familiar with, the new First Lady of New York City, Chirlane Mccray. In 1979, she wrote an article for Essence magazine entitled, "I Am a Black Lesbian." As you all know, she later married Bill de Blasio, and by all accounts is quite in love with him. Last year, she was interviewed by the Huffington Post, and she was asked, "How do you explain this? Are you a lesbian? Are you straight? Are you bisexual?" Her response was beautiful, and before we finish, I'll tell you what it was. But for now, you can roll it over in your heads, okay? And it'll give you something to think about while I drone on, okay? All right, so let's start with the term sexual identity. Sexual identity refers to how one thinks of oneself in terms of whom one is attracted to, either sexually or romantically. The key word, of course, being identity. It's closely related to, but not necessarily concomitant with someone's sexual or romantic behavior. So let's look at a few examples of how people might view themselves. I worked with a man who fully identified as gay. He was married to a woman, lived in suburbia, had 2 children, had sex with his wife several times a week, and on rare occasions had sex with men. On the other hand, especially decades ago, early in my practice, I treated plenty of men who had sex primarily or exclusively with other men, yet identified as heterosexual. Often they'd show up in my practice with hopes of finding out if they were really gay or straight. And I believe this is what people were referring to here when the question came up, what do you do when a patient asks you if they're gay or straight? Apparently, in such a case, your patient has the idea that there is a central truth concerning who they really are, and that somehow you should be able to tell them what actually amounts to nothing more than how one thinks of oneself. My dad had a cousin who fled Nazi Germany about the same time he did, and until the day he died, this cousin strongly identified as a German. He lived in Yorkville, would never miss a student parade. My dad, on the other hand, rejected any identification with anything German, other than, of course, the sanctity of cleanliness and order. I cannot imagine either of them asking a therapist to clarify for them whether they were actually German or not. The truth is that you are oriented to whomever or whatever you are oriented, and how one identifies may or may not be aligned with what one practices. Which brings us nicely to the next term I want to clarify, sexual orientation. When we're speaking of sexual orientation, we are speaking of an internal characteristic that refers to the object of the individual's romantic or sexual attraction. It sometimes has been referred to as sexual preference, but that term is generally not used anymore, the reason being that sexual preference implies freedom of choice in sexual orientation, which is not scientifically supported. Historically, sexual orientation was conceptualized in a binary fashion, which was a direct outgrowth of the binary construction of sex and gender, male and female. Thus, developmentally, as you know, in normal development, a man would be oriented towards women and vice versa, and irregular development might result in homosexual orientation, or what used to be called the perversions. As we have increasingly moved away from this binary construction of the conceptualization of human sexuality, and as researchers have studied it more closely, we're developing an ever-increasing appreciation for its fluidity and its variability. The first significant shift in this country from the binary view was Kinsey in 1948, in which sexual orientation was viewed on a continuum, with a rating of 0 to indicate exclusive heterosexual orientation. 6 was exclusively homosexual orientation. And obviously, there would be points in between. And while this is still essentially binary in its conceptualization, it allowed for people to exist along different points in the spectrum, and opened the door to the concept that sexual orientation may be composed of an admixture of varying desires. In more recent years, many writers on the subject have increasingly conceptualized orientation as much more of a rich mixture with many aspects and derivatives, and further, that sexual orientation has fluidity. One simple example of fluidity, I can tell you that, like any nice Jewish boy from the Bronx, I grew up thinking that Puerto Rican guys were just about the hottest thing that God placed on earth. When I was 15, my parents sent me, again like a nice Jewish boy, to Israel, where to my shock and horror, among the various shortages plaguing the new besieged nation, was that there was a complete dearth of young Puerto Rican men. Interestingly enough, over the course of my extended stay, a shift in my orientation started to take hold, and I developed an interest in North African men, which was completely absent before. That sexual orientation has a certain degree of fluidity inherent in it should under no circumstances be confused with the archaic, discredited, and iatrogenic concept that psychological treatment of any sort changes sexual orientation. What is possible and what is reasonable is that we can work with people, if they are so interested, in expanding their sexual repertoire. For example, I've worked with men who have experienced themselves as exclusive cops. That is to say, they never imagined in any pleasurable manner being able to be receptive to anal intercourse. If partnered with somebody who thinks of himself as an exclusive bottom, and they are content with that arrangement, great, they should live and be well. However, male couples sometimes present themselves for sex therapy with the complaint that the partner who has always been bottoming would like to top as well and feels that the price of the relationship, not being able to top, is too high. Here we have the opportunity to do what I think we can do best as therapists, which is help somebody expand beyond their existing constraints. Dr. Jack Morin, who sadly passed away last year, many of you may know his stellar work, his book, The Erotic Mind, wrote an earlier book called Anal Pleasure and Health, in which he puts forth the idea, with plenty of well-illustrated exercises, that anyone who's so interested can learn to safely enjoy anal sex. So in such a couple, the exclusive top can expand his repertoire and become oriented as somebody who's versatile. Okay, now just to return to where I began this discussion of sexual orientation, you should bear in mind that people are trying to rethink the concept of sexual orientation. And as with much of our terminology, it will continue to evolve. Some of you may have read in last November's Contemporary Sexuality an article by Corey Silverberg, an sex educator, who wrote that in our current conceptualization of sexual orientation, it poses only one question, which is both blunt and dull. What is the gender of the people you're sexually attracted to, and with whom do you want to have intimate relationships? The problem is that as sexual human beings, we actually do not fit so well into these boxes. And while there is no clear consensus in the scientific community as to how best to describe sexual orientation, we can be certain that it's far richer and more complex than the traditional viewpoints based on a male and female dichotomy. Recent questions then come up. Should such things, such variations as bondage, dominance, sadomasochism, or other various forms of kink be considered orientations? Asexuality is increasingly viewed as an orientation and certainly can be thought of as a sexual identity. For that matter, how about zoophilia or pedophilia? If you were to ask me, I'm going to tell you if you don't ask me. The answer is yes, to the extent that we are attempting to describe how someone is oriented towards romantic and sexual attractions. It's irrespective of whether the behavior is socially acceptable, healthy, unhealthy, legal, or illegal. Dr. Hannah Oleski is probably the world's greatest expert on zoophilia. She certainly concurs that regardless of how someone might conceive of its development, whether it appears maladaptive or seriously problematic, they are, by our current understanding, sexual orientations. So, returning to our main concepts tonight of sexual orientation and sexual identity, try to bear in mind that these concepts are tightly rooted in the binary concept of gender, male and female. And based on that conceptualization, the question seems simple. To which gender are you attracted? And while it goes beyond the scope of my discussion tonight, it's worth mentioning in terms of sexual identity and sexual orientation that the concept of gender is no longer considered as fixed and dichotomous as it once was, and for that matter, gender roles. As these concepts expand and gender fluidity is more fully understood as a variation rather than a disorder, so too will the concepts of gay and straight tend to lose their meaning. So don't waste your time or your patient's time trying to figure out if they are really gay or straight. The questions you should be asking as clinicians should not be directed towards an attempt to categorize your patients, but rather to gain as full a descriptive understanding of your patients as possible. Thus, the questions you should be asking should be more along the lines of, how do you think of yourself? What is it that you like to do? What do you fantasize about? You'll find yourself much closer to your patient's experience of themselves and their sexuality than you would if you constrained yourself by the more traditional and in their own way useful concepts of diagnosis, and you'll create an atmosphere in which there is a stronger working alliance, as your patients are much more likely to see you as respectful of them in attempting to understand what is important to them rather than trying to get your hands around what is wrong with them. Okay, as an entertaining aside, here are my two most memorable responses to these questions. A 22-year-old male once told me, I consider myself half straight and half bisexual. And the following, from somebody in our field, I think of myself as a black lesbian trapped inside the body of an effeminate gay male. Now, I promised you at the beginning that I will tell you what Chirlane Mccray's response was to the question of how does she explain who she is. Okay, so those of you who are mulling it over, come back, okay? Her eloquent, and she's always eloquent, response began with, I don't see why I, or anybody for that matter, should have to explain their sexuality to anybody. People grow, and people change, and people can learn to take risks. I encourage all of you to do exactly that. Allow yourselves to grow and change and take risks. Instead of seeking to find a category for your patient's sexuality that makes you feel comfortable, stay close to their experience of themselves, treat it with respect, allow them to develop whatever identity they develop, and further, don't worry one bit if it fluctuates. Most of us are trained to understand any shifts in identity as indicative of severe pathology. It ain't necessarily so. So, I hope I've provided you with some basic information, some food for thought, and now I invite questions and encourage all of you to participate in the discussion.
I just wanted to comment that I absolutely agree with you. And over the years, you know, I've had women who were married, had children, then went off and had one relationship, came back to the husband. I'm currently working with a very interesting couple where he is a trans and is going through the surgery, and he started out female.
Female to male.
Female to male, and is involved with a male, and he's a top. So, and I just think it's very, in order to be a top, he has to use is dildo an appropriate term to use?
It's a term I use.
Okay.
Right? I'm sure there's a legitimate word for it. I always say dildo.
So
are there other words?
I didn't know there was another word for it.
Well, I just didn't know if that was
vibrator,
too
right?
slangy or something.
No, a vibrator is a vibrator. A dildo.
A dildo's a dildo, right?
Yeah, well, I just didn't know if there were a more professional.
They're an ancient euderitic, though.
That's fine.
Are you taking films?
I was just curious, when you say that you've had patients who come to you and they say, am I really gay, am I really straight, am I bisexual? Is there something that usually, well not usually, but more often than not precipitates that kind of question? Is there an impending relationship crisis or a marriage coming up?
It's a good question. As I mentioned, it's something that would occur much more often earlier in my practice, because there was much more homophobia on the ground, and people were afraid to think of themselves as gay. And there are stories of people back in the day there was somebody who just wrote in the New York Times a story a few months ago where he went to an analyst for many years because he thought he might be gay. And the analyst reassuringly told him he couldn't possibly be. Very few people would pick to be a member of a minority group that's less privileged than another group. So, less so now, but I think for a lot of years and for a lot of people, the hope was, no, I'm not gay. Does that answer your question?
Yeah, no, I was just wondering now if you get the same question,
Occasionally, right? And I usually give answers along the lines of, you would know that I wouldn't. You can think of yourself however you want to think of yourself. Let's talk about what you're interested in, what you do.
Right, Betty, what brings somebody into treatment for that question now as opposed to 10 years ago?
Oh, I think, as I said, it's much rarer, but what brings somebody in for treatment now is still the same thing. The hope that they're not, that they had a particular image of what they should be, and the feelings they have are not in alignment with that, and they're looking to straighten it out.
First of all, thank you very, very much. And
Well,
I
thank all of
can
you.
only, have one utterance right now, not the dozens that are it was very thought-provoking. When you work with adolescents, there's a lot that's very different and very important because they're going through identity development. Let me say a few things. That's one of the reasons why this question comes up with adolescents, because they really don't know who the hell they are. And there are a couple of things going on. You say, who would want to belong to a minority? Well, a whole lot of adolescents have precisely wanted that for the last decade or two. Okay? They want to be part of that avant-garde kind of group. I always thought my daughter always had to identify with the underdog, but she really now is in a gay marriage, and it really is who she is.
Yeah.
Okay. But, so some of the kids are just plain old experimenting, and there's a lot more options around. But a lot of them are really, as uncomfortable and struggling as anybody ever was.
Yeah.
I think even if they're in New York, it's supposedly, the most liberal place to be, it's truly deeply troubling to them. And, we may, and I found it very helpful with kids, to talk about fluidity. I mean, it so calms them down. It so creates an alliance. There's such a relief when they hear that. But we have to remember that what you bring with you when you're developing is the cultural terms and conventions that are around you. So we're very binary, we're very categorical in our culture. So,
Comforting. Yeah.
That's still what you're trying to figure out when you're a kid.
Absolutely. I just wanted to make a couple of comments on what you said, which thank you very much. One thing, just in terms of societal reactions and adjusting to society, There was just a study that came out, and I wish I could cite the reference. The life expectancy for a gay person in a place like New York, where it's relatively open and free and comfortable, versus places where homosexuality is despised. The life expectancy, the difference is 12 years.
Wow.
Yeah, it's not like we found a significant difference of 3.8 months, right? 12 years. The other thing, in case anybody's interested, that's very much related to what you're saying, the American Psychiatric Society is having their annual meeting in New York this year, and I found out today that psychologists can register for the whole conference for $205. Right? I was interested in only one symposium, and it was much cheaper to register for the whole conference. On Monday the 5th, there's going to be a very interesting discussion, and it's about working with gender non-conforming children. Right? And it's going to have three perspectives. One is Diane Ahrenshaft, who's a psychologist, and speaks about this as gender creativity, and certainly encourages it and supports it. Ken Zucker, who's a psychiatrist and is very much old school, of kind of like the Susan codes, you try to get them to butch it up or feminine, right? And then there's a third speaker who's a Dutch guy who, if I can remember his name, I probably couldn't pronounce it correctly. So the Dutch guy will speak about the approach that they use in Holland, which he calls the wait-and-see approach, which I'm interested in hearing how that works. So if anybody's interested in $205 buys you that and the whole conference.
I want to thank you because your kind of experiences is significantly different from what I have in my practice. Interestingly enough, what I've found that focusing on sexuality is generally a distraction from the main issues, because it doesn't seem to matter very much whether it's man with a man or woman with a woman, but what kind of relationship they're having, what they really experience in their life. I haven't seen very much of a difference between men who, for example, men who have a lot of gay partners or men who have a lot of women partners. The underlying essence is that they're, as I can see, is that they're avoiding intimacy in one way or another, and that's often the case. But anyway, these kind of issues I found is much more useful, and when people bring in these issues about my gender as something of a way of circumventing the real issues that may be underneath.
Yes and no.
But that's my
I'll say a few things because I can't help myself. One of the things, I'm old enough that my training was entirely psychoanalytic because it was the only thing that existed, except for some people who were like running rants up at Columbia University. Part of the appeal to me of sex therapy is that you work from the other side of the tube. You start with the simplest problem, and rarely does sex therapy, behavioral treatment, occasionally, but rarely does it fix it. And more often than not, you have to work on the underlying issues in order to get that working. And the people who I think are really brilliant in the field are people who came out of a real old school psychoanalytic tradition and then adopted sex therapy and can prescribe exercises while holding in their head what's going on dynamically. Right? Intimacy, I'm not as convinced as you are, and what I'm thinking of specifically, right, is is that if we roll back the clock to when I was in graduate school, and that was really the start of the AIDS epidemic. And if you walked around my neighborhood, where I had my office in the West Village, it was like a zombie movie. I mean, it was the land of the living dead. And what made the headlines was the number of different sexual partners that men had, it's because they're not capable of intimacy. And on the other hand, I saw the kindest acts of loving kindness and people taking care of each other and people loving each other under those most difficult circumstances. So I watch out for my inclination to think if you be able to be close to somebody, you'll settle down. I think people can, and it may or may not be my preference, people can be in loving, stable relationships if they care to, be capable of great intimacy, and express the sexuality in a way in which they have many partners. And in fact, my PsyD project, my doctoral project, was exactly that. Since this was in the headlines, right? I took a standard instrument. I don't know what's the BSRG? What's that one? The brief symptom inventory, right? The one if you want to write a quick and dirty dissertation.
It's not the symptom checklist 90.
Yeah, it's a shorter version of that, right? I took that and I compared it to sexual partnership styles, right? To see if the happily married were the healthy ones, and the ones who were having sex all over the place were the unhealthy ones, right? At least in my sample, indistinguishable. The only significant finding I found was that whiter, higher educated, wealthier men look better on a standard instrument than poorer, darker, less educated men.
Of course, you're right. You don't want to say one size fits all. And one of the first times I found myself pretty confused in the Army. I was in an outfit of mountain men, basically, where they actively discussed, is it better to have sex with a woman, a sheep, anything that they could put penis in. And one man actually said, he was convinced that there was a sheep that loved him because he began having sex with it when it was a lamb, and now every time it sees him, it runs towards him backwards. So,
there's
and
another.
it's also true that you can have one partner, but it doesn't necessarily mean that it's going to be intimate. There are different degrees of that too. It isn't. That's just the surface. It's the experience underneath it.
Something else that has come up recently with a client of mine isn't so much related to sexuality per se, but it's a guy with very low self-esteem, and he's in his 60s, and he's been questioning all of his life whether maybe he's really gay because he feels inadequate. He's been happily married for like over 40 years. He has no fantasies about being with men, thoroughly enjoys sex with his wife, and it's a reflection of his feelings of inadequacy about himself.
Yeah, because inadequacy equals weakness equals femininity equals people are despised.
And he's Latino, so the macho.
Especialmente.
Sí. But it's something that I think isn't often enough addressed in this context.
The issue of self-esteem?
The question of sexual identity based on being related to issues of self-esteem as opposed to pure sexual preferences. Sexual, what is it we're calling it now?
Orientation.
Okay.
Is this idea of fluidity rather new?
For me, yeah.
What?
For me, yes.
Well, because I've had this come up a couple of times. Patients have come in, and, you know, I think I might be gay, but I have a girlfriend and I like having sex with her. But, well, why do you think you're gay? Well, I'm attracted to men sometimes. I look at their muscles, you know. And
Look, you think of yourself how you think of yourself. I had a gym buddy for years who couldn't have sex with a man if you put a gun to his head, right? And was crazy about having sex with men, right? The only thing that I saw that he was interested in was a man's physique, and he knew every guy in the gym and what he was shaped like and how much work he put into what. He didn't particularly like women, right? I don't know. He's married to, he's in a miserable marriage now. I don't think he's really gay. I think he's a female-hating guy who's into men's bodies and likes to have sex with women.
He is who he is.
Yeah.
It's funny you say about discussing the title or titles as they morphed of your presentation, because I was a little taken aback by the title sexual orientation, because I thought and sexual identity, because
As I said, I only picked out the title.
right, because what I have found most useful for me in the past couple of years is thinking about gender identity here and sexual orientation here, so that it's clearly one is who I think I am in terms of gender, which is still binary. Okay.
Ish.
Binary-ish. Okay. But no, I mean, because even if you're in transition, you're from one to another. So we're still pretty, okay.
If you want to boil it down to
Well, let me put it differently.
the physiological, chromosomal
Yeah.
realities, most of the time it's one or the
We
other.
haven't even mentioned inter, but let's not. Okay.
Let's not. 'Cause
But
that confuses
but
us.
I think saying gender identity means I'm talking about what gender I feel myself to be, which is what some people are wondering about, versus I'm wondering about who I'm attracted to, my object choice. So that is sexual orientation. I just find that those two terms are very handy.
Oh yeah.
They work better than sexual for both orientation and identity. Okay.
Run by me again.
I use
Because
gender for
I think
identity.
I'm agreeing
I
with you.
use
But
gender for the issue of who am I, what gender do I identify with, and sexual orientation for who am I attracted to.
I would agree with that. I think of myself as a man who is attracted to men, except on Sunday afternoons when my boyfriend has his feet up on the coffee table and is watching the Giants game. Well, no. Well, I'm doing the wash, and I don't really cook.